brain science and communication science to change the culture in Tennessee to be informed by ACEs, trauma, and resilience. And this culture change has prompted many professionals, communities, and philanthropists to use the latest brain science to better prevent and mitigate ACEs, trauma, and toxic stress. 4 years of comprehensive, coordinated, and collective work from both the private and public sectors have positioned Tennessee as a national leader in ACE response. So, with your leadership and collaboration, we hope this Lunch and Learn series will propel and expand the cutting edge work as we support professionals and community members to learn from innovative efforts that are happening at the national and the local levels. And we also hope that the participants will consider ways to promote more equitable communities for all children and families. So we just want to remind you that you are on mute and you will not be able to unmute yourself. So if you do have any questions or comments, please just put those in the chat box for the presenters' responses at the end of the presentation. This webinar is being recorded and will be uploaded to the Tennessee Commission on Children and Youth YouTube page, so check that out. And finally, please fill out the survey that pops up at the end of the webinar and let us know if you'd be interested in joining any of the learning communities that are available. And as a reminder, you will receive a certificate, a link to the presentation, and a copy of the slides, and they'll be emailed out within the next few days after the presentation. So this webinar may go over by a few minutes. If you have any questions, if you want to stay and participate in that, you can. You will still receive a certificate if you have to get off, and that's fine. If you're calling in, please email Jen at jen.croft@tn.gov to let her know you will need a certificate. That's only if you're calling in. So thank you to the Tennessee chapter for the National Association of Social Workers for providing the CEUs for this event. And we thank Building Strong Brains Tennessee for sponsoring the event. And if you want to be notified of future Building Strong Brains Lunch and Learns, please also email Jen at jen.croft@tn.gov. And Serena has put that in the chat box just to make sure you have the correct spelling and whatnot. So without further ado, we'd like to go ahead and introduce our wonderful speaker, Kaylin O'Connor. So glad that she is with us today. She is a senior associate at the Center for the Study of Social Policy. And there she works to promote better outcomes for young children and their families. So she has a heavy focus on promoting those protective factors that children, families, and communities need in order to thrive. And this includes coordinating the Strengthening Families National Network of 35 states that use CSSP's Strengthening Families Protective Factors Framework. So that's also something that she will tell us more about, and please feel free to check that out further. They have some wonderful trainings and doing great work there. So Caitlin's work has addressed a wide variety of issues, including ACEs and resilience, family support, and child abuse and neglect. And she holds a master's degree in human development and family studies and a graduate certificate in prevention and intervention science. So welcome, Caitlin, and we all look forward to your presentation.
Thank you so much, Christina and Serena and Jen. Thank you all for inviting me to do this session back when it was originally an in-person conference, and I'm transitioning to the Lunch and Learn format. So I'm glad everyone was able to join us. And I'm going to go ahead and jump into my slides. I wanted to say a little bit for those of you who aren't familiar with CSSP. Stands for the Center for the Study of Social Policy, which can be a little bit hard to discern exactly what it means. We do a lot of translation of research and new ideas into strategies for on-the-ground implementation. We focus on innovation and transforming innovative ideas into action. So we work primarily in community change, systems change, and policy change. And we are always trying to connect with folks in communities, parent leaders, providers, system leaders, so that we can help understand how things are working and how they can work better. I'd encourage you to check out our website at cssp.org. And also wanted to mention, Christina made a reference to our trainings. We do a monthly webinar about strengthening families, which is open to anyone. We have a lot of other webinars and resources that come out on a very regular basis. So if you go to our website, at the bottom of every page is a stay connected or something like that box. You can put your email in and choose which of our newsletters you'd like to receive. So I encourage you to do that. You can get our newsletter about strengthening families, about early childhood system building, about policy, about racial equity. We have a number of topics we focus on, and I encourage you to check that out. So for today, we're going to talk about how early childhood experiences matter for a lifetime. And I know that I am not saying anything that you don't already know, but I do want to say that when we have these conversations about how what happens in early childhood can matter for a lifetime, we often go straight to talking about how the bad things that happen in early childhood matter for a lifetime. And we actually know that the good things also matter. And probably every single human being who's ever lived has had a combination of good things and bad things that happen in early childhood that together influenced the rest of their life trajectory. So what we're going to be talking about today is how to broaden that discussion about what happens in early childhood to include the good and the bad and the neutral, and to really think about how those early experiences influence the developing brain. So I know that you all have some grounding already in ACEs and toxic stress, so I'm going to start by covering those just really briefly, and then we'll get into the strengthening families approach and some exciting new research around positive childhood experiences and HOPE, which stands for the health outcomes of positive experiences. And then a little bit about what HOPE and positive experiences look like right now while families are in a unique and often stressful situation with coronavirus. So without further ado, we will jump into our topic for today. I know that you're all very familiar with ACEs, so I'm not going to talk about what they are or list them off. They're here on the slide. I'm going to make a couple points that not everyone always remembers when they're talking about ACEs. So one thing is to remember that ACEs are not measured with any precision at all. It's a blunt instrument. It's, did this happen or did this not happen? We don't know about how often something happened, how severe it was, what kind of support a person got afterwards. It's just yes or no. And on one level, that makes it even more interesting that they're correlated, and the number of ACEs is correlated with so many outcomes, because it isn't precisely measured, but it also means that just knowing someone's ACE score doesn't really tell us a lot about their childhood. Also important to note that ACEs are not individually predictive of outcomes. All of the studies around ACEs are about the cumulative score and how it correlates. People have separated out individual ACEs and found some much weaker correlations to some outcomes, but it really is that cumulative effect that shows the correlations that, that the ACEs are known for. It's also not an exhaustive list. So there are a lot of things that could happen in a childhood that are traumatic and would have the same effect as an adverse childhood experience that aren't on this list. And that's a little bit arbitrary, a little bit, research-based of what had power statistically, but it's definitely not, oh, if 7 other bad things happen to you, it doesn't count because they're not on the list. That's not how this works. And then related to that, these are not inclusive of chronic stress from community and societal factors. So the stress of living in a neighborhood with a lot of violence going on around you, or the stress of experiencing racism in your interactions in, out in the community, whatever format that might take. All of that can also add up to chronic stress in a way that the ACEs don't really capture. So I know that you have recently heard about the pair of ACEs, or many of you have anyway. So again, I'm not going to dwell on this, but just to say that we really do need to pay attention not just to the ACEs we usually talk about, which are things happening within a home and within a family, to look at what else is going on around them. And I'm increasingly focused on how the things that are going on around the family, which is described as adverse community environments here, influence and affect what happens within the family. So sometimes we can address some of these adverse community environments and prevent a lot of ACEs within homes by doing that. That's not always the case, but a lot of family stress is caused by these adverse community environments, which may then lead to some of the negative ACEs that we're all learning so much about. I'm actually going to skip over this one since I know that you all have good ACEs education already. Just a reminder that most adults report having experienced one or more ACEs in their childhood. And then a classic slide showing some of those correlations we know so well of how these negative outcomes become more likely as you have more ACEs in a person's childhood. But again, that is correlation, not any individual predictive values. So this is a pyramid that we often see from the CDC, which tries to describe the mechanism by which adverse childhood experiences influence health and well-being throughout the lifespan. So sort of going from the community context, generational context, social conditions, ACEs, disrupted neurodevelopment. You all know the routine. But what's been a question ever since we started to understand this science was what drives this? And why is it true for some people but not all? Because one of the things we always need to note is that this is a pyramid because not everyone who experiences the things at the bottom also experiences the things at the top, right? So what's going on for people being able to have some of these experiences, we'll look particularly at ACEs, and not have the disrupted neurodevelopment or not have the impairment and adoptions of risky behaviors and all of that follows. So what we're going to talk about are some of the ways that we're starting to understand why that doesn't happen for everyone. And one piece was this new understanding that came after the ACEs study about the concept of a toxic stress response. So the idea that some children can have these highly adverse experiences, but not experience some of the negative repercussions down the road. And the understanding is that that's because some children have a toxic stress response to some situations, which other children might not have a toxic stress response in the same situation. I'm saying children, but actually adults can also have a toxic stress response, which is basically when the stress response system in the body overwhelms other systems. And we're particularly concerned about that during childhood and early childhood because there's so much other development that's going on that when all of the energy and resources in the body are going towards this toxic stress response, as one of my colleagues puts it, if all your focus is on survival to the neglect of other developmental tasks for a while, that throws off development in some ways or influences development in some ways. And we believe that a toxic stress response is less likely when there's adult support and buffering so that a child feels safe again soon after a negative experience. That's harder when it's a chronic situation. That's harder when the adults who should be the source of that support are also the perpetrators of the stressful situation. So, and it's also harder when the adults that should be the source of that support are themselves completely caught up in a toxic stress response to a situation. So sometimes we see families going through a crisis where the parents are very able to still be the parent they want to be, to kind of block out their own response when they need to be engaged with their child. And then we see a lot of parents that can't do that, perhaps because of their own toxic stress background, their own adversity and in their childhoods. We don't know exactly why, how temperament and experiences and all of that interact, but we do know that when children have extreme adversity and don't have that buffering support, they have this toxic stress response and then are more likely to have the negative outcomes going forward. So now we get to the fun part, strengthening families and protective factors. So I am a strengthening families champion, I suppose, have been for a long time and now work at CSSP coordinating that work nationally because I just believe so strongly in the premise of strengthening families, which is summed up here in one very concise statement from Dr. Carl Bell, who was a psychiatrist at the University of Illinois, who said risk factors are not predictive factors because of protective factors. So we know from the science and from living in this world and people we know and our own experiences that there are a lot of people who have a long list of risk factors or a high ACE score or however you want to say that are thriving. And we believe that the reason they're thriving is because of protective factors and because of other experiences that buffered the potential negative of some of the risk factors they experienced or would be categorized as having. So with our Strengthening Families initiative, we focus on what programs and communities and families can do so that families are stronger in these protective factors that we have seen lead to strengthened families and optimal child development and a reduced likelihood of abuse and neglect. I will say this is our current logic model, and we are working on revising it to better show that a lot of this support for families' protective factors happens outside of programs. It happens in communities and faith-based settings, in schools, in extended family relationships, and some of it happens through policy and through, I think we're all seeing right now how much federal and state policy affect family well-being and ability to meet their basic needs and focus on anything beyond that. So we're working on revising this logic model. For now, it's very much about what programs and workers can do, but we know that there's a lot more that goes into whether families have support to build their protective factors. But all of our work with Strengthening Families focuses on these 5 protective factors. I'm not going to define them because I think most of you are familiar, but I will encourage anyone who's not familiar with it to go to our website. You can either go to cssp.org and click around a little and get to Strengthening Families, or you can just type in strengtheningfamilies.net. That's like a little link straight to the Strengthening Families part of our website to learn more about what this is all about and how we encourage programs and others to help families build these protective factors and why they matter. Okay. I also wanted to share, and I'm glad I included this because I saw in the introductions at the beginning that several of you work with youth or in a high school setting. And so I always like to remind people that we actually have a parallel framework of protective and promotive factors for youth that's called Youth Thrive. And our idea is that when we go from in early childhood, we focus on the young children and their parents and those foundational relationships that are built in early childhood that really depend on the parents' protective factors more than any of the child's internal capacity. But as children get older, not that their parents are not still incredibly important, but the child's own characteristics and strengths start to matter a lot more in terms of predicting their future success. And you'll notice this is a circle because we know that many young people are or will be parents themselves. So when we build their protective factors in the youth setting, that carries into their parenting either right away or later on. And so I would say for those of you who are working with young adults, particularly if you're working with young parents, thinking about their protective factors and their developmental needs as a young person and how that interacts with their developmental needs as a parent and the needs of their child. That's really, I think, looking at both of these frameworks together can be really helpful. Okay, so how do we connect these threads from this world of ACEs and toxic stress to protective factors? Well, we've always known that protective factors make positive outcomes more likely and make negative outcomes less likely. And we thought we knew why, and I still think this, but we believed we knew that it was because we promote those foundational relationships that matter so much between parents and young children. And we prevent some ACEs in adversity by building up the protective factors. We buffer some children from parent and community stress when parents understand what that stress can do to their children and have some tools for buffering them. And we can help prevent the toxic stress response when adversity occurs because parents have that capacity if their protective factors are strong. And we can promote healing and resilience, whether that's for a child who's just experienced something negative or for a parent who's looking back at 20 years ago, what they experienced and how they can heal from that and parent their children in a way that they will be less likely to experience that. So we have always operated Strengthening Families from this understanding, but we didn't really have that ACE-style data. And now we're starting to get it. So that's why I'm very excited. So we're going to get into this new science and research around positive childhood experiences and hope. Okay, so Now I'm speaking about other people's research, and I will do the best I can to present it, but if we've got questions that come up, I might have to get back to you by checking with the researchers behind this directly. So as you know, the ACEs study, the original one was done in 1998, and then was added to the behavioral risk factor surveillance system, so a lot of states have done their own ACE studies. I'm not sure whether Tennessee has done that, but someone can jump in. I'm guessing you probably have. Patients were answering questions about their own childhood, and it turned out that their answers about what happened in their own childhood had strong correlations with their mental and physical health as adults. Now we have a study of PACEs, positive childhood experiences. It's not quite as easy to pronounce PCEs, but we've been saying PACEs. For the 2015 population study done in Wisconsin, where actually when the behavioral risk factor survey was adding ACEs questions, they also added some positive childhood experiences questions. And I'll show you what those questions were in a minute. And the results came back with a strong correlation to mental health and some correlation to physical health and other outcomes. So, exciting stuff. Let me, somehow it's not advancing. There we go. So these are what the positive childhood experience questions were. I'm not going to read them off. You can see them. But it's a lot about having somebody to talk to, feeling your family stands by you, feeling connected to your community and your school, feeling supported by friends, having at least 2 non-parent adults who were taking a genuine interest, and feeling safe and protected by an adult in their home. I will say, to me, I think most adults answering these questions would be answering for their adolescents. I don't think we've quite figured out how to ask questions that get at early childhood, and certainly not questions that get at what kind of support their parents had for protective factors. But I do think these align well with the protective factors we've been talking about all along. And as this data is coming in and growing and these questions are being refined over time, there's so much we can learn from it. So a study was published last fall in September about these positive childhood experiences. If you're into the data, look that up. It's in sorry, I have a chat box over my, whoops, now I'm jumping all over. I'm trying to see which journal this was in. I believe it was in, yeah, it was in the JAMA Pediatrics, so Journal of the American Medical Association Pediatrics. Look that up if you want to read the details, but I'll share some of the highlights of what they found. So positive childhood experiences have a protective function for adult mental health. So this is a little complicated, but just looking at whether people reported these positive experiences or not, we see that folks with 0 to 2 positive experiences, so very few of those statements were true for them, were more likely to have depression or poor mental health compared to those who had 6 or 7 of those positive experiences. So 6 or 7 positive experiences is a 72% lower odds of experiencing depression or poor mental health. That in itself is maybe not totally surprising, but seems very important. And even when we look at the less extreme comparison, those with 6 or 7 of those positive experiences have a 50% lower odds of adult depression or poor mental health. That's self-reported, of course, but I think that's really telling that it's not like the 0 positive experiences compared to the 7 positive experiences, but even the middling to the high, there's a large difference. Now, when we look at how these positive experiences mitigate the effect of ACEs, so we are all very familiar with those ACE numbers of, few ACEs, better outcomes, high ACEs, poorer outcomes. But when we look at people who had no ACEs, that's the blue line here, and had 0 to 2 positive experiences, 3 to 5 positive experiences, or 6 to 7, the blue line doesn't change too much. If you didn't have ACEs, it's not a huge difference in your adult reporting of ever having depression or poor mental health. If you have 1 ACE, and 0 positive ACEs. 1 ACE, sorry, 2 ACEs and 0 positive experiences. 4 to 8 ACEs and 0 positive experiences. Those are the numbers closer to what we're used to seeing, right? That the negative outcome is much more likely. When we add in positive childhood experiences, those numbers go down. No matter how many ACEs you have, if you also had positive experiences, the likelihood of the negative outcome is lower. So I hope I'm explaining that in a way that is clear. I'm going to leave that up while I take a drink here, so you can take it in. Okay, so we also see that positive childhood experiences have that protective effect for physical health. It's not as strong a correlation, but it is there. So what we're looking at here is for adults who had 3 or more ACEs and had this particular positive childhood experience, the difference in how many people report their own health as being poor or fair. So that's like a general question. How do you rate your physical health? Poor, fair, good, or excellent, right? So these are the 2 lower ones on that selection scale. And if people had 3 or more ACEs, or sorry, I guess it's actually more than 3, so 4 or more ACEs. So if you had 4 or more ACEs and you felt your family stood by you, 17% of those folks have poor or fair health. 27% of those who had 3 or 4 or more ACEs and say their family didn't stand by them have those poor outcomes. And we can see that for whether folks felt supported by friends, whether they felt belonging at their high school, whether they enjoyed community traditions. For all of those, the negative outcome is more likely with a high ACE score and not having that PACE than with a high ACE score and not having that positive experience. So it really seems the positive experience are playing a protective function or buffering function here. So why do we think this is, right? Some of it is, like I said, all of us who have lived in this world and know people and have our own experiences have some understanding of that, but sometimes the science around ACEs and toxic stress feels so definitive or deterministic that we have to remind ourselves that brains are actually incredibly flexible. With growing evidence of broader brain plasticity than we used to think. So when we look at how people recover from strokes, we look at brain changes that have been documented from people doing meditation and other positive experiences. We look at post-traumatic brain growth. So when people have a negative experience, they actually sometimes have heightened brain growth afterwards. And I mentioned meditation, but also when children learn to read, there are actual changes in their brain that happen as a result of making all those connections. So we know there's a lot of brain plasticity, and our science is just starting to capture that. And I think this study of positive childhood experiences helps to explain that and helps to illuminate more of kind of what's going on. That, like I said, most of us had a mix of positive and negative experiences in childhood, and those experiences, I'm sure there's a lot more science to come on the timing of negative experiences versus positive, and how much buffering was happening versus something happening negative with no buffering and then positive later. Like there's a lot to still learn, but it does seem clear that we can show through population research that those positive experiences do help to buffer from the effects of negative experiences. So we're back to this pyramid and my question about why this is true for some people but not all, and we start to see the answers. So we know there are family and community factors that I call protective factors that make it more or less likely that these social conditions and local context and even the generational and historical trauma, like how much of an effect that will have on individuals. We know that with adverse experiences, some people have a toxic stress response and some don't. There's a lot of things that go into that. We know that even after disrupted neurodevelopment, there can be healing and resilience. At any point along here, there can be healing and resilience that help to explain why some people continue up this pyramid and some don't. And now we know that positive childhood experiences are a huge factor in how much those adverse childhood experiences affect later trajectory. So all of this research around positive experiences you can find on a website called positiveexperience.org. I'm proud to be part of the National Advisory Board for this project called Healthy Outcomes from Positive Experiences. Dr. Bob Sagi at Tufts University is leading that work. And he and one of my colleagues, Charlene Harper Brown, had a paper a few years back where they were starting to frame out this hope concept before as much of the data was in as I just shared. But they really boiled it down to 4 pillars, or I think sometimes they call them building blocks. My graphic might be out of date. That relationships matter. As for children to have positive experiences, relationships is one form of that, which can be with other children, with adults in the family or outside of the family, and through interactive activities. The second is environment. So is it safe? Do people have equitable access to housing and safe neighborhoods? Is housing stable? Do they have a safe environment for living, playing, and learning? So not just the home environment, but the school environment and the neighborhood. Is there a playground? Those kinds of things. And then a positive environment, both physical safety and emotional safety and support. The third pillar is engagement. So having a sense of connectedness, being engaged in school, being engaged in community activities, social and civic activities, feeling you're part of a community is one important form of a positive experience. And then social emotional learning. So having opportunities to play and learn with peers and to do art and drama and music in collaboration with other people, all of that builds the brain in ways that we believe can buffer from the negative experiences. So go to positiveexperience.org. There's a great blog series there. The research is summarized, and as more research comes out, that's where it will be available as well. Oops, this is not advancing. There we go. So what does this mean for your work? I put some of the questions that I have. I'd love to, as we get, we're not going to stop for discussing all these questions right now, but I'm hoping that you'll think about them and maybe type in some thoughts in the chat box, or just think about it for yourself. But, the fundamental one is, how do we support positive experiences and build protective factors and promote resilience? And that goes hand in hand with, how do we prevent ACEs and mitigate the effects of adversity? It seems like we know that promoting positive experiences is good for everybody, whether they've experienced ACEs or not. So lots of people have a role of just promoting those positive experiences, which is fantastic. We also do want to prevent ACEs, and for kids who are having those adverse experiences, we do need to figure out ways to mitigate them, which can involve treatment or supporting parents, whatever that looks like. There's the question of, how do we talk to parents about all of this? I will say that from the first time I heard about ACEs, and I actually wrote the ACEs report for Wisconsin the first time that we collected that data, I have been very bothered by how parents are presented with this information. I think a lot of parents find out about ACEs in a way that feels like it's their fault if their child is having problems. That deterministic sort of, well, they have these negative experiences, so it's all downhill from here. It can be a very dark and fatalistic way of talking about what's happened with their children. Whereas I think when we add in the positive experiences, it becomes a much more hopeful conversation. It's not a coincidence that the acronym is HOPE for Health Outcomes of Positive Experiences, because that's what's needed, is for parents to acknowledge that some of the experiences they or their children have had can have negative effects, and they may need to do some things to mitigate that or intervene with that, but also that positive experiences are one of the ways to do that. One of the things that I love about positive experiences is, when you saw that list, it wasn't, we went to Disney World every year, right? It wasn't, I got that pony I wished for my 9th birthday, right? It's like not expensive things, not things that you need to live a life of luxury in order to experience. And so all parents can say, well, how can I make sure that my child has at least 2 adults outside of the family who they know care about them? That's something that everybody can do with some support. Some people might need more support to find those people and understand how to facilitate those relationships. We all need to be alert to adults who want to have that genuine interest in our child for the wrong reasons, and we need to all talk about that. But knowing the importance of those relationships, knowing the importance of feeling connected to school, how can parents support that? There's a lot more to work with there than just a list of ACEs and checking off what things have happened. So that's, as you might be able to tell, that's something I feel pretty strongly about. And then another question, how do we reduce stress and adversity and increase supports to thrive for all of the families in our communities? We know when we look at that pair of ACEs that both some of the adverse childhood experiences that happen within the family are more likely to happen in families that live in neighborhoods that are experiencing these adverse community conditions. And we know that in our communities, it is not equally distributed who lives in communities that have those struggles and who's more likely to be in poverty. And all of these community factors, a lot of racist systems that have gone into who lives where and who gets what support. We need to pay attention to all of that because a lot of families are under more stress than they should ever need to be. And how do we increase supports to thrive so all kids can be having these positive experiences and not experiencing those adverse childhood experiences or adverse community experiences? And then the question of what are children experiencing right now that will influence their future? And I will say that Dr. Sagi and I did a presentation similar to this one back in March, right when the coronavirus lockdowns were starting, and everyone was, just kind of wrestling with those questions. And I think we continue to wrestle with that, even as we know that, this is longer term than we initially thought. Supports have come in to play in a lot of ways, but we know there are still families that are struggling. So what do we think about those? How can we make sure kids are having those positive experiences even under quarantine and when schools aren't in person and all of that? Okay, so some of what this means for practice. And I look forward to seeing and hearing what you typed into the chat box. I'm not able to look at that while I'm talking. I'm not that skilled. So,
Connor, would you be open to a couple of questions?
Oh, sure. Let's do that.
We have some questions around really engaging parents and how to, what if the parent's not interested? What if the parent does not want to be a part of the child's counseling session?
I think a lot of parents have a lot of walls up pretty high, especially, some with anyone they interact with, but especially with service providers. So some people have personal and family histories of, being taken advantage of or abused or not listened to or just not served well by service providers. And even though that's not about you, that is still about the system that you're a part of. And so you need to find ways to demonstrate and convince people that you're doing your best and you're listening to them. I think as much as possible, letting parents be in the lead for those decisions. So if the parent's not willing to participate in a child's therapy, is that partly because they don't think their child should be getting therapy? Or is it because they're worried that, what a therapist might ask them and what they might say that could lead to problems? One idea I heard recently that's really stuck with me is that for so many parents in our society, asking for help leads to consequences. And obviously, sometimes that's how it has to work, because if you ask for help and we find out that your child is actually in a really unsafe situation, there will be consequences. But for the majority of families, when they're asking for help, we should be able to see that as a sign of strength. We should be able to help them meet the needs they have without the consequences or punishment for not having been able to meet those needs before. So I think there's a lot that goes into that resistance that we see from parents sometimes, and it can take a long time to work past those barriers. I don't mean to say that in a flippant way, like, oh, just convince the parent that you're one of the good guys and it's going to be okay. Like, obviously, that takes a lot. But I would say, like, starting from what the parent thinks their child needs and what the parent thinks the family needs, and ensuring that as much as possible they can get those needs met without being punished, I think is a really good place to start.
Oh, that's great. And we'll just take one more really quickly from Patricia. It's along those similar lines. How do you approach a situation where the parent denies that a child has any stressors?
Yeah, I mean, I think it might be similar, a fear of, you know, if I admit that we don't always have enough food in the house, in an ideal world, that results in food coming to the house. But in some worlds, unfortunately, that results in you're going to get a CPS visit that doesn't necessarily involve bringing food to your house. And you're going to be on a list now of parents we're worried about or whatever. So like some of it is that how do we get parents to let their guard down? And I think acknowledging that, addressing those fears up front when we can and saying, you know, I have resources that can help your family if you can tell me what your needs are. And maybe just listing off what the resources are rather than asking what the stressors are. Because you might find that they'll say, yeah, actually, if we could, you know, get some food support and some help with figuring out how I'm supposed to get to work when I have a 4-year-old at home, that might be easier than asking them to address it from the stressors point of view. Just some thoughts.
Thank you.
Okay, well, let's keep going and we will get to more questions. I've got a few more slides to go through of content and then we can get into more questions. So this is just kind of thinking about how we balance ACEs with hope and protective factors. We have a model shown here about that we screen for problems, often labeled as ACEs or otherwise, that we screen for problems and we offer therapies and interventions to respond to those. We also have a model over here, which can happen on its own, or ideally can happen in concert with the problems part, but identifying protective factors, screening for strengths, identifying the positive experiences that families are providing for their kids. That can then help us to create opportunities for engagement and celebration. So we can say, that is so fantastic that your kid is feels really connected to school, and let's see, you know, how can that help them succeed in life? And, you know, kind of in recognizing and celebrating that is going to make you a much more, I don't know where I was going with that. It's going to make the family see you as an ally and a partner, and maybe help to break down some of those walls. But it also offers opportunities to strengthen protective factors. So we can then say, oh, you know, you're doing so great with this and this. Maybe you would also like to do this. Maybe we can also think about, you know, how we need to help you build up your concrete support in times of need, or, you know, whatever it might be that we can put in protective factors and strength framing. And so ideally, we have systems, if not every individual provider, but at least systems that do both of these things. So we are checking in on risk factors and asking about challenges, but we're also identifying protective factors and strengths. And we're creating these opportunities for engagement and celebration and for strengthening protective factors, which make it more likely that people will engage with and accept the therapies or interventions that we're offering. So when we have hope, the healthy outcomes of positive experiences, it provides us with a language to honor the reason we're doing the work we do. Like even if, you know, like I've for a long time identified as my primary career is in preventing child abuse and neglect, but it's a lot more positive and true to say I'm in the business of promoting positive childhood experiences, right? That's more dynamic, tells you what I'm actually doing, and it honors why I got into this. And it also gets at the centrality of health equity, because these are positive experiences that everyone can create for children across the board that aren't as influenced by racism and inequities and the unequal distribution of poverty, all of that. We can get much more towards equity when we focus on positive experiences and honor how important that is. It definitely supports this paradigm shift towards a strength-based approach, which many of us have made that shift already, but didn't have the science to back it up. And other people may have been reluctant to make that switch because they didn't have the science. The HOPE research really helps to shore up anybody who was reluctant and gives the rest of us who are already committed to being strengths-based, it gives us a lot more science-based reasoning to put behind that. It infuses the positive experiences into all of our work around ACEs, which I think is so important for all the reasons I've said. And then those building blocks are really flexible, so you can think with families or with programs or with community groups about, what can we do around relationships and environment and engagement and social emotional learning? Where do we have a contribution to make sure that more kids have that? And other things might be somebody else's lane, and that's great too. We always say that with the protective factors too, that your program might really specialize in one or two of those protective factors, but as long as you know who in your community you can refer families to for the others and know that families have that support elsewhere, you don't have to address all of them. Similarly with these building blocks for positive experiences. Okay, I'm gonna take another drink and get into HOPE in the time of coronavirus. Okay, so we know that childhood experiences last a lifetime, and I think it's really important that we stop and think about what children are experiencing right now. A lot of the conversation, especially around young children, has been about the challenges for parents in caring for young children while they're also working from home or when childcare is not available and they need to go out to work. But we also need to recognize that children are people who have had their lives disrupted too. So children had routines that are different now. In some ways, they might be better from the child's perspective. I'm home with my family all day and there's nothing to do but hang out, right? We're playing in the yard for hours at a time. And while for parents, that might be in some ways a crisis of like, we're barely holding it together with not going anywhere or seeing anyone else. For the child's perspective, if the parents aren't too stressed, that can be a really positive thing. But how can we think about what kids need in this crisis? They need ways to maintain their relationships with families and friends. This might not be as true for a toddler, but even a 3 or 4-year-old, certainly a school-age child, needs some way to, connect with grandma and grandpa, even though we don't get to see them right now. Have some kind of connection with family and friends that they normally see, their friends from school, their teachers. How can you maintain some kind of relationship, even if it's over video or pen pals, whatever that might be, meeting outdoors when you can trust the kids to keep a distance, which is harder with the younger kids. Children need developmentally safe environments, and that includes safety. It includes that we need to find ways for families to still be able to keep a roof over their head with everything else that's going on, whether that means finding ways to provide childcare so that parents can still go to work, or shoring up the unemployment benefits, whatever it might be, so that families can maintain their homes and maintain those safe environments. And also developmentally safe in the sense that children are getting their needs met. There's enough food, there's an emotionally available adult, they're having the interactions and building those foundational relationships that they need. The third one is engagement with community. That can be hard right now, but I've been optimistic about things I see where people are, chalking messages, whether it's kids that are involved in writing chalk messages for their neighbors, or that they go on a walk and they see that and they see the teddy bears in the windows and what different neighborhoods have done. Older kids who are helping sew masks for people in their community and things like that, where people are pitching in and feeling like they're part of the efforts in their community or just part of their community, period. And that could also mean, continuing to watch church services online because they're part of that community and the family is making an effort to maintain that connection. And then all children need opportunities for growth. And, you know, I think there's the dim view of what's going on right now for kids who are stuck at home. And there may be a number of kids who are just watching TV, hopefully watching good, appropriate, child-friendly, developmentally appropriate TV if that's the case. But there are also a lot of opportunities for growth in the sense of, you know, kids who are able to just really dig in on something they want to learn about, who are old enough, you know, have reading skills already and can just read something they're really interested in, not focused on what school might be directing them to do, or who are learning how to cook, learning how to do the laundry, learning skills that they'll need in life, and those are opportunities for growth. And for young kids, really young kids, you know, that might just mean that they still have a climbing structure somewhere that they can use for that gross motor development, and that they are still going on walks around their neighborhood and looking at the plants and the bugs and learning in those ways. So it doesn't have to be growth happening in formal educational settings, but what are the ways that kids are still getting opportunities to learn and grow and develop skills? I will say that both the Positive Experience, the HOPE website, and CSSP, my organization, have a lot of resources and materials about coronavirus. So Bob Sagi started a blog series called Love in the Time of Coronavirus in March, and has been adding to that and having lots of guest bloggers and interviews with people. So I'd encourage you to check that out on the Positive Experience website. And then at CSSP, we are more on the side of policy briefs, but those can be good too. And so we have a clearinghouse of all our COVID-19 resources where you can find policy briefs about policies that affect families, most of which our argument is that we need it now and always. But you can check that out for our arguments about paid leave, a better immigration system that respects and supports families, a wide variety of other policy issues that we've taken a stand on in relationship to this public health crisis. We also have a couple of strengthening families materials we developed specifically as a response to the crisis. So there's a handout for parents about building resilience during troubled times. And we encourage you to either just share the link to that with parents. We have it on just a web page, so they don't need to download anything. Or folks who can download something, we have it as a PDF. And you yourself could print it off and hand it to families if you're delivering food or diapers or you know, doing other ways of giving physical things to parents, even mailing things to folks who might not have broadband internet. So that's a tool for parents. And then we have a tool for providers called Strength-Based Practice in Troubled Times, sort of focusing on what for most of us is a different experience where so many of the families that we're in contact with are in crisis. Most of us are used to, you know, a more balanced day between some families that are in crisis and some that are not. And I think especially at the beginning of this crisis, but probably still, a lot of us are just meeting one need after another. So how to stay strength-based, both in kind of one-off interactions with parents and then also in those longer-term service relationships. So those are all available in our clearinghouse. I encourage you to check those out. And now we have time for questions.
Fantastic. Thank you so much. And for those of you who have a comment or question, please feel free to type it. In the meantime, Julie asks, how can we best help those who have a toxic response that are unable to move past that response and continue to alienate and make poor decisions and see that they have issues?
Oh, that's rough. I think one strategy that I like that I heard from someone who was implementing strengthening families in a child welfare system, because they were struggling with how to open up a relationship with a parent that is based on a CPS report and still have it have the possibility of being a positive relationship. And so they would start by having the parent tell the story of how they got into CPS. And I think you could apply this in a lot of different scenarios, just sort of tell me the story of, what's going on with you, or why your child, why you came for support, or whatever it might be. And by doing that, they let the parent shape what the focus of the conversation would be, or at least what the parent wants the focus of the conversation to be. You get some insight into someone's well-being and their attitude. If the story is just about blaming others, that tells you something about where that person is. If the story is about, I made a mistake, or I didn't recognize this issue my child had, and now I need support with it, whatever it might be, knowing what they recognize in themselves, whether they're, open to help right off the bat, or if they're more defensive, I think that can set the stage well. Not that that's going to totally dictate the format of the rest of the conversation and what kind of intervention they actually need, but starting on that foot of tell me what you're here, why you're here, and what you need. I also think there are some, intake and assessment forms that are built around either our protective factors or other ways of building around strengths that you can talk to parents about. Tell me about your social connections, like who do you talk to when you need help, and who's your best friend, how often do you talk to them, like those, just kind of asking questions that aren't coming from a deficit place, but that will still help you to see and help the parent to identify where they do have needs for support. I know it's really hard. I think this is the third question that's sort of on those same lines of what about a parent who's kind of resisting this support? And like I said, there can be a lot of reasons for that. And I think it just is almost always going to take time and patience. Sometimes it might be that a different provider is going to meet that need for them. And if you reach a point where you can just tell you're not breaking through, maybe it's a warm handoff to another provider who shares their cultural background, or who in whatever way might be more appealing to them as someone they would actually open up to. And that's not your fault, but sometimes people don't click, or those preconceived notions get in the way. And sometimes we do need to recognize that we might need to switch them to a different provider to break down those walls.
Thank you. And I want to, I know many people, your lunch break is over and you're back to the rest of your day. So thank you so much for joining us. We have a few more questions. We're going to stay on. I'd like to recognize these great comments. Patty says, thank you for reminding me to focus on the positive. And Daisy says, thanks for hope. And Julie says, thanks so much. Focus on strengths and positives. They have we can allow families to know they have the power even when they feel powerless, and lots of thank yous. So I would also like to pose this question from Elena. She says, what resources would you recommend for the more rural areas that are underserved?
Yeah, that's so rough. I did mention that's why we did the tool we did for parents with a design that people could print it off and mail it, because we know that a lot of people, we made this leap to everything's online, and that's doesn't work for everyone, especially in rural areas. So I think, using the mail, using driving around and dropping off resources for parents. I know that with geographical distances being far apart in some places, that's hard to do. But if you do have, a lot of places had a budget for getting out to places to do home visits, which they haven't been able to do for a while. So there might be some gas money still available to get out and drop things off with parents. I think one other thing I'll say, despite the challenges that a lot of people have with internet, I know that here in Wisconsin, the family resource centers, when they started offering all their programs online, they found they were getting participants from all across the state who were outside of their service areas and were too far to drive, or were in their service areas but too far to drive, because some of those are large areas where the Family Resource Center building might be an hour and a half from some of the people who they're intended to serve. But people really started connecting when it was online or by phone. So I think, not making any assumptions about who has the access and who doesn't. There are different ways to reach people. And I think, more and more we're seeing like mobile family resource centers, a van that comes around and is in a specific neighborhood or area on a specific day of the week. And people can come pick something up and get some information if that's set up in a safe way during this time of a pandemic. And I think it just takes some creative thinking and recognizing some of the limitations, but also some of the possibilities that open up when things are offered online and anybody can join. I also was recently talking to someone who said they couldn't do like Zoom meetings for parenting education, but they just sent out a teleconference line and people could call in, and people actually did, just using their phones, because people want information and connection. And if you make it available in a variety of ways, more people can take advantage of it.
Thank you. And Sharon says, I hope to see more focus on positive childhood experiences and hope in the future. We see so much on ACEs, but not enough on PCEs, and hope being taught. So she says, thanks so much.
Yeah, thank you. Yeah, I'm really excited. I think people are hungry for this. So the more we can get it out, the more it will be part of the conversation.
Great. And Julie says this is also true. She's a director in a rural area, and families do reach out. So, and then we'll take one more question here. Debbie says she works with Healthy Families, is her organization, and she's trying to help a 20-year-old who needs therapy but is very resistant. They refuse to accept therapy. What are some ideas you may have?
Yeah, I wonder, I think obviously Healthy Families is not the same as therapy, but being in Healthy Families is better than not being in anything. And so getting some support, even though it's not therapy, staying connected to that service is really important. I would encourage you to look at our Youth Thrive tools. We actually have a Youth Thrive survey that might kind of give you some, not to use it as a survey or assessment tool, but as a conversational tool to talk through with this young mother where she sees her strengths and where she might be able to identify needs. I think in that way you can start to open up the conversation about how some of those needs might be met and give her some perspective. I think one of the things that I think about this more from a parenting education standpoint, but I think it's also true just for adults, is that, none of us know what we don't know. And so if you don't know the milestones of normal child development, you might not recognize red flags. So your child is 3 and not talking yet, you might just say, oh, he's quiet, and not realize that is a sign that this child needs help. Might not know there is help for that. So I think when you, talking to this 20-year-old and looking at something like the Youth Thrive survey that, gets at sort of adolescent and young adult well-being might help her to kind of go, oh, maybe what I'm experiencing is a little bit outside of the norm and maybe I do need help for that. Whereas she might think that her depression or anxiety or whatever issues are just life. Right? So kind of opening someone's eyes to the fact that there are other ways to function and there are services available that could help a lot. I also think right now we're seeing this surge in online therapy options. And so if this is someone who has online access, it might be less intimidating than walking into a therapist's office to engage in some online therapy, and whether that opens the door to further future in-person sessions or not, it still might meet the need.
Oh, yeah, that's really great. And I'm looking at it here online. I put the link in there. That's really neat. It's kind of, we do independent living assessments in child welfare, so it's sort of taking it to that next young adult level. So that's really cool to identify. So, and Debbie says, thank you so much for the information. That's all of the questions that we have. We had lots of wonderful comments. Dana, my colleague, you're right. This is helpful for independent living. Yeah, I think it might be helpful, Dana. She's an independent living coordinator at Children's Services, so we could maybe be able to use that. So here, and some folks were asking for your contact information. Here it is, and we will also be sending out a PDF of your presentation today. We'll send that out tomorrow. Cindy says, thank you so much for doing this.
And I'm putting my email in the chat box. I think I saw at some point someone had sent me a personal message with a question, and I couldn't read it while I was presenting, and now I can't find it, so feel free to email me directly.
Well, this is wonderful. Okay, let's see. Elizabeth asks, do you have advice for survivors that are self-harming?
Oh, boy. I don't really know. I would say that's a therapy intervention required, and I don't know enough about that to say anything. I should just shut my mouth. I'm always like, well, maybe this, maybe that, but I don't actually know that, so I should stop talking.
That's okay. And if anyone that's still with us maybe has a resource for Elizabeth, let's see, then feel free to type that in the chat box. Those here may know something for that situation. But yes, thank you so much for all the resources, and especially during COVID, I can only imagine all the, the impact that COVID is having.
Right, and so much we're just not going to know for a long time what effect it's having.
I think it'll have a huge impact. Carol says, thank you. This was so informative. I agree. I love hearing about positive childhood experiences. It's time to integrate that into the conversation. Mary Ann says, thank you so much. Great presentation. Thank you, Cheryl. Great. Thanks, Ligarius and Shonda. So, well, thanks again, Ms. O'Connor. We really appreciate your work and coming and talking with our community today here in Tennessee. I'm so glad we're able to share this information, resources with everyone. Clara, these are the resources I needed today. Thank you so much. It's awesome.
Perfect. Well, thank you so much for the invitation, and it was great to connect with all of you.
Yes. Have a great day, everyone. We appreciate all of you.
Bye, Kaylin. Thanks again.
Bye. Thank you.
Really appreciate it. It was wonderful.